Chapter 23 from my lady, facials. Why do we need to study facials? Because it'll help busy clients to relax, it will improve their appearance, and help them feel better about themselves. Knowing the basics of skin analysis and basic information about skincare products will enable you to offer your clients advice when they ask for it. Although you will not treat a skin disease, you must be able to recognize adverse skin conditions and refer clients to seek medical advice when needed. Learning the basic techniques of facials and facial massage will give you a good overview of and an ability to perform these foundational services. You may enjoy this category of services and may consider specializing in skincare services. Good skincare can make a big difference in the way skin looks and in the way a client feels about his or her appearance. A facial, also known as a facial treatment, is a professional skin treatment that improves the condition and appearance of the skin. Besides being very relaxing, facial treatments can offer many improvements to the appearance of the skin. Proper skincare can make oily skin look cleaner and healthier, dry skin look and feel more moist and supple, and aging skin look smoother, firmer, and less wrinkled. A combination of good salon facial treatments and effective individualized home care will show visible results. Consultation. You must always conduct a consultation and a skin analysis. Skin analysis determines skin type, skin condition, and needed treatment. The consultation allows you to ask questions about the client's health and skincare history and to advise the client about a home care regimen. Before the beginning of the consultation and analysis, your client will complete a client intake form. The main purpose of a client intake form is for the client to document any contraindications that might prohibit certain skin treatments, procedures, or products. Sometimes it's referred to as a health screening. A contraindication is a condition the client has or a treatment the client is undergoing that might cause a negative side effect during a facial treatment. An example would be having a pacemaker. Isotretinoin, also known as Accutane, is an oral medication used to treat cystic acne and causes thinning of the skin all over the body. Do not give treatments for at least 6 months after stopping the drug. Avoid exfoliation, peeling, or stimulating treatments. Use of this product can cause the skin to blister or peel off during waxing. Retin-A, also Reno-Tazorac or Differin. Avoid treatments that would include exfoliating, stimulating, or peeling. Use of this product can cause the skin to blister or peel off during waxing. Pregnancy. Use no electrical treatments or any other treatment without a physician's written permission. Pregnant women may develop sensitivities that they didn't have before they were pregnant. Metal bones, pins, or plates. If a client has a metal bone pin or plates, avoid all electrical treatments as electricity may affect the metal. Pacemakers or other heart conditions, you want to avoid all electrical treatments. Any known allergies, avoid the allergens or fragrances. Seizures or epilepsy, avoid electrical and light treatments as it could trigger a seizure reaction. Use of oral steroids such as prednisone, avoid stimulating or exfoliating treatments or waxing. The steroids can cause thinning of the skin, which could result in blistering or injury. Autoimmune diseases such as lupus, avoid any harsh or stimulating treatments. The reactions can be unpredictable in some cases. Diabetes. Diabetics heal slowly. Get a physician's approval before treatment. There are no specific reactions, however, caution should be taken. Blood thinners. Extractions should be done with the physician's permission as well as waxing. Blood thinners may cause bleeding or bruising. Sensitive or redness-prone skin, avoid heat, harsh scrubs, mechanical treatment, and stimulating massages. It may aggravate the redness. Open sores or herpes simplex, which is cold sores. Avoid all treatments until clear with doctor. These sores could spread or flare up and could be a sign of an infectious disease. A recent facial surgery or laser treatment, treat only with the physician's permission. Also under consultation is record keeping. During the consultation, keep the client intake form and service record card with you to record any necessary information from one card to the other if needed. The service record card should contain the following. Client data, their name, address, and phone number, their occupation, their date of birth, which is used to determine signs of premature aging of the skin, medical conditions that might affect treatment, medications, any medications a client is using, including topical drugs for the skin. If they have any contraindications that may include a pacemaker, metal implants, pregnancy, diabetes, epilepsy, allergies, high blood pressure, all of that needs to be on there. If client has had a previous treatment, what treatments were performed? What skincare products is the client currently using? And a notation usually of how the client found out about you, how they were referred to the salon. Also, you're going to write down observations on their skin type, skin condition, and any abnormalities of the skin. You're also going to write on their home care recommendations, because they may not buy it right then, but the more they think about it and they see how nice their skin looks, they may come back and you might not remember what you suggested. So write that down. Don't hesitate to recommend services and products that will be beneficial to the client. To achieve the best results from a treatment given in the salon, they should lead with some kind of home care regimen that supports the treatment products. Determine skin type during the skin analysis. At this point, you've carefully read the client's intake form and discussed your questions with the client. During the first consultation and before every subsequent facial treatment, it is important to perform a thorough analysis of the client's skin. During a skin analysis, you will read the health screening form, have the client change into a smock, seat them in the chair, drape them, use a hair cap, headband, or towel, have the client remove their jewelry and put it away somewhere, recline them in the chair, wash your hands, warm the cleansing milk in your hands and apply cotton eye pads to the client's eyes. Now you're going to look through the magnifying lamp. It's a magnifying lens surrounded by a circular light, sometimes called a loop or a mag light. They're used for skin analysis, close hair removal, including tweezing, electrolysis, and waxing. You're going to want to observe the pore size. The amount of sebum produced by the sebaceous glands determines the size of the pores. Obvious pores indicate oily skin. Lack of pores indicates dry or alopecia skin. Skin type is determined by how oily or dry the skin is. It's hereditary and cannot be permanently changed with treatment. Skin conditions are characteristics of the skin associated with a particular skin type. Oily skin produces too much sebum and will have large pores. The skin will appear shiny or even greasy. Pores may be clogged from dead cells building up in the hair follicles. Open comedones are a mixture of solidified sebum and dead cell buildup stuck in the follicles. Closed comedones are small bumps just underneath the skin surface. Open comedones are also known as blackheads, closed comedones, whiteheads. The difference between closed and open comedones is the size of the follicle opening, which is called the ostium. Excuse me. Extraction. Extraction is a procedure in which comedones are removed from the follicles by manual manipulation. Dry or allopetic. Allopetic means lack of lipids. It becomes dry or dehydrated because it does not produce enough sebum. Normal skin has even pore distribution. It's very soft with a smooth surface and lacks wrinkles. Normal skin is unusual. Combination dry. There are obvious pores down the center of the face. Pores are not visible or become smaller toward the outer edges of the face. Pores may be clogged on the nose, chin, and center of the forehead, and dry, non-visible toward the outside edges of the face. Combination oily is a wider distribution of the obvious or large pores down the center of the face, extending to the outer cheeks. Pores become smaller toward the edges of the face. There are comedones, clogged pores, or obvious pores in the center of the face. Acne. Pores are very large in all areas. Acne is considered a skin type because it is hereditary. There is a presence of numerous open and closed comedones, clogged pores, and red papules and pustules. Pustules are pimples. How a pimple is formed. The follicles will become clogged with bacteria and dead skin cells. With the dead skin cells covering the pore, the anaerobic bacteria will thrive and cause a pimple. Analysis of skin conditions. Conditions are generally treatable. They're not hereditary and are associated with a particular skin type. Dehydration is indicated by flaky areas or skin that wrinkles easily on the surface. Gently pinching the skin surface may result in the formation of many fine lines. This indicates dehydration. Dehydrated skin may be caused by lack of care, improper skincare products, sun exposure, etc. Treat by using hydrators appropriate for the skin type. Hyperpigmentation is dark blotches of color. Most are caused by sun exposure or hormone imbalances. The use of a mild exfoliant, sunscreen, and avoidance of sun exposure can help. Sensitive skin, characterized by a thin red-pink look. The skin turns red and is easily inflamed by skincare products. Avoid the use of strong products. Rosacea is a chronic hereditary disorder and can be indicated by constant or frequent facial blushing. Dilated capillaries, which are distended or dilated surface blood vessels. This is also known as cuperose. Avoid use of treatment that releases heat or stimulates the skin. Aging and sun-damaged skin. Aging skin is indicated by loss of elasticity. The skin tends to sag in areas around the eyes and jawline. Wrinkles may appear. Treatments that hydrate and exfoliate will improve the skin appearance. Sun-damaged skin has been chronically exposed to sun over the client's lifetime. Hyperpigmentation, wrinkles, and sagging skin will be present. Skincare products. Most skincare products are designed for specific skin types or conditions. There are several major categories. Cleansers are formulated to cleanse the surface of the skin and remove makeup. Cleansing milks are non-foaming lotions designed to cleanse dry and sensitive skin types and remove makeup. They can be applied with hands, but must be removed with dampened facial sponges, a soft cloth, or cotton pads. Foaming cleansers are wash-off type products. They contain surfactants, also known as detergents, that cause a product to foam and rinse easily. Toners, also known as fresheners or astringents, are lotions that help rebalance the pH and remove remnants of cleanser. They may contain an exfoliating ingredient to help remove dead cells. Some contain higher alcohol content for oilier skin types. They're applied with cotton pads. Alcohol-free toners can be sprayed on the face. Exfoliants are products that help bring about exfoliation or removing excess cells from the skin surface. Removing the dead skin cells makes the skin look smoother and clearer. Mechanical exfoliants work by physically bumping off dead cell buildup. Your granular scrubs, gommages. Gommage is a French word meaning erase. It's a peeling cream that is rubbed off, removing dead skin cells through friction. Microdermabrasion scrubs are mechanical exfoliation scrubs that contain aluminum oxide crystals. Chemical exfoliants contain chemicals that loosen or dissolve dead cell buildup. Popular exfoliating chemicals are alpha hydroxy acids, which dissolve the bonds and intercellular cement between the cells. You must have hands-on supervised training before attempting chemical exfoliation treatments. Salon alpha hydroxy acid treatments are often referred to as peels. Salon products contain 20 to 30% alpha hydroxy acids. Prior home use is required. Certain chemical peels shouldn't be used in the salon unless the client's been using a 10% product at home for at least 2 weeks prior to the salon treatment. When to avoid mechanical peeling: skin with visible capillaries indicates fragile blood vessels, thin skin that reddens easily, older skin, and skin being medically treated. Also acne-prone skin. You do not want to use a chemical exfoliant. An enzyme peel. They are keratolytic keratolytic enzymes that dissolve keratin protein in the surface cells. They're often derived from papaya fruit or pineapple. They may also be made of beef byproducts. There are cream-type peels that usually contain the papain, applied to the skin, allowed to dry to a crust, and then rolled off. And then you have powder-type peels, where powder is mixed with water and applied to the face. It does not dry, and it can even be used with steaming. Benefits of enzyme peels are reduce the clogged pores and oily skin, promote skin smoothness, increase moisture content and hydration, reduce hyperpigmentation, decrease uneven skin color, eliminate or soften wrinkles and fine lines, and increase elasticity. Another product we use is moisturizers. They help increase the moisture content of the skin surface, exactly what they say they are. They are mixtures of humectants, which are hydrators or water binding agents, which are ingredients that attract water, and emollients that hold moisture in, which are oily or fatty ingredients that prevent moisture from leaving the skin. Moisturizers for dry skin use heavier cream and contain more emollient. Moisturizers for oily skin use lotions that contain smaller amounts of emollient. Sunscreen and day protection products. Day protection products and sunscreens are necessary to help prevent premature aging and skin cancers. Daily moisturizers should contain broad-spectrum sunscreens. Night treatment, on the other hand, are heavier than day products and may contain a higher level of conditioning ingredients. Serums and ampules. Serums are concentrated products that generally contain higher concentrations of ingredients. They're designed to penetrate the skin and treat various skin conditions. They're applied under your moisturizer or sunscreen. Ampules are the individual doses of serum that are sealed in small vials. Massage creams are lubricants to make the skin slippery during massage. They often contain oils or petrolatum. Masks. Masks are a combination of ingredients for the purpose of toning, tightening, hydrating, and nourishing the skin. Quite a few different masks here. Clay-based masks are oil-absorbing, cleansing masks. They have an exfoliating effect and an astringent effect on oily and combination skin, making large pores temporarily appear smaller. Cream masks are often containing oils and emollients as well as humectants. They have a very strong moisturizing effect. Gel masks, used for sensitive or dehydrated skin, contain hydrators and soothing ingredients. Alginate masks, often seaweed-based. They come in powder form to be mixed with water or serums. They'll form kind of a rubberized texture. A treatment cream, which is a specialty product designed to facilitate change in the skin's appearance, or a serum, is generally applied under this mask, generally used only in the salon. Not something they're going to be using at home. A paraffin wax mask. They're specially prepared facial masks containing paraffin and other beneficial ingredients. They're melted at a little higher than body temperature before application, quickly cool to lukewarm temperature, and harden to a candle-like consistency. They are used with treatment creams. Eye pads and gauze are used to protect facial and eyebrow hair. Modelage masks. They contain special crystals of gypsum, a plaster-like ingredient. They're used with treatment cream. The product hardens on the skin. Setting time is about 20 minutes. They are beneficial for dry, mature skin or skin that looks dull and lifeless. Massage is not recommended before or after modelage masks. Gauze. It's something that you use. It's not a mask in itself. It's a thin open mesh fabric of loosely woven cotton. It holds the mask on the face while allowing the ingredients to seep through and benefit the skin. Gauze should be cut in a size to fit the entire face, with cutouts for the nose, mouth, and eyes. Basic techniques. Massage is the manual or mechanical manipulation of the body by rubbing, pinching, kneading, tapping, and other movements to increase metabolism and circulation, to promote absorption, and to relieve pain. Basic massage manipulations. Massage pressure should always be applied from insertion to origin of the muscle. Insertion is the muscle where the muscle is attached to another muscle or a movable bone or joint, and the origin is where the fixed attachment. Effleurage is a light, continuous stroking movement applied in a slow, rhythmic manner with the fingers or the palms. Petrissage is a kneading movement performed by lifting, squeezing, and pressing the tissue. Fulling is a form of petrissage in which the tissue is grasped, gently lifted, and spread out. That's usually used on the arms. Friction is a deep rubbing movement in which you apply pressure on the skin with your fingers or palm while moving it over an underlying structure. It includes movements such as the following: chucking, which is grasping the flesh firmly in one hand and moving the hand up and down along the bone while the other hand keeps the arm or leg steady. Rolling is pressing and twisting the tissues with a fast back and forth movement. Think snake bite. Ringing is a vigorous movement which the hands placed a little distance apart on both sides of the client's arm or leg and working downward, apply a twisting motion against the bones in the opposite direction. Tapotement is a percussion movement. It's a tapping, slapping, or hacking motion. In slapping movements, keeping your wrist flexible allows your palms to come in contact with the skin. In light, firm, and rapid slapping movements, one hand follows the other with each slapping stroke. Lift the flesh slightly. Hacking is a chopping movement performed with the edges of the hands. Some of you have done this when you were in choir in high school. Both the wrists and hands move alternately in fast, light, firm, and flexible motions against the skin. Hacking and slapping movements are used only to massage the back, shoulders, and arms. Vibration is a rapid shaking of the body part while the balls of the fingertips are pressed firmly on the point of application. A caution: do not massage a client with high blood pressure, a heart condition, or a stroke victim. If the client has arthritis, be careful to avoid vigorous massage of the joints. Maintain constant communication with the client during the massage and adjust your touch according to his or her needs. Physiological effects of massage. Skillfully applied massage directly or indirectly influences the structures and functions of the body. The immediate effects of massage are first noticed on the skin. The area being massaged shows increased circulation, secretion, nutrition, and excretion. Every muscle has a motor point, which is a point on the skin that covers the muscle where pressure or stimulation will cause contraction of that muscle. The location of motor points varies among individuals due to differences in their body structure. Some of the benefits of massage. Skin and all structures are nourished. Skin becomes softer and more pliable. Circulation of blood is increased. Activity of skin glands is stimulated. Muscle fibers are stimulated and strengthened. Nerves are soothed and rested. And pain is sometimes relieved. As a general rule, normal skin or scalp can be kept in excellent condition with a weekly massage if accompanied by proper home care. Facial equipment. You need to know what these are about. I will do another one where I go over just the equipment, so this will be pretty quick. Facial steamer heats and produces a stream of warm steam that can be focused on the client's face or other areas of skin. A brushing machine is a rotating electric appliance with interchangeable brushes that can be attached to the rotating head. Skin suction or cold spray is used to increase circulation and to jet spray toners onto the skin. Do not use this on sensitive or inflamed skin. It's often used to hydrate skin or remove mask treatments. Electrotherapy and light therapy. Galvanic and high frequency are examples of electrotherapy, which is the use of electrical currents to treat the skin. Electrotherapy should never be administered on heart patients, clients with pacemakers, clients with metal implants, pregnant clients, clients with epilepsy or seizure disorders, clients who are afraid of electric current, or clients with open or broken skin. Always check with your state regulatory agency to determine which electrical machines are approved for use in your state. An electrode is an applicator for directing the electric current from the machine to the client's skin. Galvanic machines use 2 electrodes. Excuse me. The anode is the positive electrode to perform cataphoresis. A cathode is the negative electrode to perform anaphoresis. Galvanic current accomplishes 2 basic tasks. Desincrustation is the process of softening and emulsifying hardened sebum that's stuck in the pores. And iontophoresis, which is the process of using galvanic current to penetrate water-soluble products that contain ions into the skin. A type of galvanic treatment using a very low level of electrical current is microcurrent. It has many applications in skincare and is best known for helping to tone the skin, producing a lifting effect for aging skin that lacks elasticity. High-frequency current, this uses only 1 electrode. An electrode is an applicator for directing electric current from the machine to the client's skin. It was discovered by Nikola Tesla. It is used to stimulate blood flow and to help penetrate products. It can be used for acne-prone skin because of its germicidal effect. The most common electrode is the mushroom-shaped one. Direct application, applied directly to the skin. Indirect application, the client holds the electrode, creating an electrical stimulating massage. This is also called Viennese massage. Light therapy, there are several types of lights used for skincare treatments. We're just going to cover a couple. Infrared lamps are used to heat the skin and increase the blood flow. And then LED, which is light emitting diode. This treatment uses concentrated light that flashes very rapidly. It helps with wound healing. In our field, it is used to minimize redness, warm the lower level tissues, stimulate blood flow, improve skin smoothness, and help acne-prone skin. Red lights are used to treat aging and redness. Blue lights are for acne-prone skin. Microdermabrasion is a type of mechanical exfoliation. It uses a closed vacuum to shoot crystals onto the skin, bumping off the cell buildup. Facial treatments fall into 2 categories: preservative, which is maintaining the health of facial skin, and corrective, to try and correct some skin conditions such as dryness, oiliness, comedones, aging lines, and minor conditions of acne. Some of the guidelines that you want to follow: speak quietly and professionally, explain the benefits and answer any questions, provide a quiet atmosphere, and you're going to want to work quietly and efficiently. Make sure that you're set up ahead of time, that you're not digging around for stuff. Maintain a clean environment. Follow systematic procedures. Do them the same every time. Warm your hands. Keep your nails smooth and short. And always analyze the skin. Special notes. Facial treatments for men. When I teach you, I usually teach you to follow the jawline and under the cheek and on the cheekbone. But with men, you want to follow the pattern of the beard. So if they're usually downward and outward movement, so we would be going from like the cheekbone to the jawbone, rather than going from the chin to the ear on the jaw. You want to make sure that you're using sponges instead of cotton pads on a man's face, because cotton's going to get caught in the stubble or the beard hair. Avoid using perfumed products on men. Make sure you have fragrance-free products or neutral scented products. Home care is the most important factor in a successful skincare program. Consult thoroughly regarding home care. Discuss treatment in a well-lit environment with a mirror. Organize your products for purchase and use. Aromatherapy is the therapeutic use of essential oils. You do want to make sure that if you want to do aromatherapy, that you have separate training in just aromatherapy, because you can cause some problems with that. I mean, there are a lot of, when you're just starting out especially, use the blends, use the things that are already made for you, and they tell you what to do. When you get more into it and you start learning more about aromatherapy and things that different oils can do, then you can make your own blends. But make sure that you are measuring things out the way you're supposed to, or you just use the pre-made aromatherapy blends. That is it for Chapter 23. I will see you next time.